Greetings, Reverend Sharpton, National Action Network members, grassroots organizers, activists, faith leaders, and everyone gathered here today to make change, make a difference, and deliver justice in America. For 30 years, Reverend, you and the National Action Network have fought to create that social change, to give life to Dr. King's dream of a just society, and to protect the hard-fought victories for civil rights and civil liberties for every community. For 30 years, you've stood on the front lines in this long march toward justice. And when our communities needed you most, Reverend, you and NAN were steadfast in the battle against this COVID pandemic. Thank you for delivering 1.8 million meals to communities in need. Thank you for partnering with rideshare companies to provide rides to vaccine sites. Thank you for engaging clergy to address vaccine hesitancy. And thank you for being part of the COVID-19 Community Corps. I'm here today because the fight for justice and equity extends to the doctor's office and to our health care infrastructure. For far too long, barriers, visible and invisible, have hindered communities of color, particularly the Black community, from accessing high-quality, affordable health care. The kind of care that provides peace of mind. President Biden understands this. The Department of Health and Human Services understands this. I understand this. We're committed to working to defeat COVID-19, to tear down health inequities put in stark relief by the pandemic. This past year has been hard on all of us, but few have suffered as harshly as this country's marginalized communities. COVID-19 surfaced something many of us have known for a long time. Inequities are putting our most vulnerable communities at risk of getting sick and dying. Now, I'm the son of working-class immigrant parents. We didn't have much, but my family had access to health insurance coverage thanks to my father's union job. I understand what it means to have health access and security. It gave my family the peace of mind to live our lives. And the President understands this too. At HHS, we are putting equity at the center of everything we do. We're using what COVID has illuminated to inform our broader efforts. Last month, the President signed the American Rescue Plan Act into law, the biggest expansion of health care since the Affordable Care Act, Obamacare. Because President Biden kept his promise, 360,000 uninsured Black Americans are eligible to save money on health care coverage, and 328,000 will be eligible for $0 out-of-pocket costs for their health insurance plan. 328,000 people will be eligible in the Black community for $0 out-of-pocket costs. Not bad. On average, 4 out of 5 current healthcare.gov consumers will be able to find a plan for $10 or less per month once they receive their tax credits. What's more, we're going to keep the door open a little longer for Americans to lock in that health care by extending the special enrollment period for health insurance sign-up. And we will continue to tackle COVID by supporting state and local efforts, including distribution of testing, treatments and vaccines, supplies, and protective equipment. We launched the COVID-19 Community Corps, a nationwide grassroots network of local voices and trusted community leaders to encourage people to get vaccinated. And we're investing $10 billion to get vaccines in the arms of communities that have been among the most hurt in this pandemic. Communities of color, rural areas, low-income populations, and other underserved communities are part of that effort as part of our COVID-19 response. We've got plenty of unfinished business in this country when it comes to extending the same access to care and the security that comes with it to every community. But I assure you, we are working and we won't stop until everyone has that same access to health and security that we all deserve. On this issue and many others, we depend on your help. I encourage everyone to share the word with every community, to log on to healthcare.gov, and to take advantage of President Biden's special enrollment period. More than 500,000 Americans have already done so. And we've seen the largest increase in enrollment among Black consumers and among Americans near the poverty level in 2 years. 17% of those new enrollees identified as Black. So I'm encouraging everyone to log on to healthcare.gov. you might find that you can save yourself some money, get better care, and get some peace of mind with it. I also want to encourage you to join the COVID-19 Community Corps and help us get your friends, family, and neighbors vaccinated. That's a just cause. That's a fight we can win. Reverend Sharpton, to you and the believers, the fighters, the aspirers of the National Action Network, congratulations and thank you for 30 years of struggle and success for a better America. And thank you for allowing me to celebrate with you.